everybody. Hope you all are fine. The topic of discussion for today is the femoral triangle. So, at the end of this session, the participant should be able to define femoral triangle, describe the boundaries and contents of the triangle, describe the femoral sheath, its formation and septa, and list the compartments with their contents. Describe the femoral canal, its boundaries and contents. Describe the femoral ring, its boundaries and femoral fossa. Describe the femoral hernia, its components, coverings and contents, and its course. And treatment after strangulation. What is the precaution to avoid bleeding during surgery on this type of hernia? Tabulate the differences between femoral and inguinal hernia. Femoral triangle is a triangular space or depression in front of the supromedial upper one-third of the thigh just below the inguinal ligament. It is bounded superiorly by inguinal ligament, medially by medial border of adductor longus, laterally by medial border of sartorius, and its floor is formed medially by pectineus and adductor longus and laterally by iliopsoas. Its roof is formed by fascia lata, except at saphenous opening where it is covered by cribriform fascia. As regard the contents of the femoral triangle, a number of vital structures pass through it just underneath the skin, and these contents are divided into two sets, medial and lateral. Medially, femoral sheath and its contents are present. The contents of the femoral sheath are femoral artery and its branches, femoral vein and its proximal tributaries, that is great saphenous and deep femoral veins, deep inguinal lymph nodes and associated lymphatics. The lateral part is occupied by femoral nerve and its branches. Easy way to remember the contents is the navel. Lateral to medial, this represent nerve, artery, vein, and empty space with lymphatics. As regard the clinical relevance, femoral artery pulsation can be felt at the mid-inguinal point, that is midway between pubic symphysis and anterior superior iliac spine. This pulsation signifies that heart is beating and blood is flowing to the lower limb. Heavy bleeding in the lower limb can also be stopped by applying pressure in the femoral triangle at the mid-inguinal point. Remember the difference between mid-inguinal point and middle inguinal point. Blood is also aspirated in collapse status of veins, and this procedure is named as femoral venipuncture. This artery is an easy access to a major artery, such as in the process or procedures of coronary angioplasty and peripheral angioplasty. Femoral sheath is a funnel-shaped sleeve of fascia which encloses upper 3 to 4 cm of the femoral vessels. Upper end of this sheath is wider, whereas the lower end, which is narrow and fuses with the fascial investment of the vessels. This sheath is asymmetrical when we look on it from the anterior aspect. Lateral wall is almost vertical, whereas the medial wall is oblique and is directed downwards and laterally. It is divided by two vertical septa into three compartments. The lateral compartment contains femoral artery and femoral branch of genitofemoral nerve, whereas the intermediate compartment contains femoral vein. The medial compartment, which is the smallest compartment, is named as femoral canal. As regard the formation, the femoral sheath is actually downward extension of two layers of abdominal fascia, that is fascia transversalis anteriorly and fascia iliaca posteriorly. Both these fascia merge with outer layer of the femoral vessels almost at the lower end of the femoral triangle. Femoral canal is the medial, the smallest compartment of the femoral sheath. It appears as a truncated conical canal, which is about 1.25 centimeter long with the base directed upward, and this base is named as femoral ring. The femoral canal is bounded anteriorly by fascia transversalis, posteriorly by fascia iliaca, laterally by medial septum of femoral sheath, and medially where the fascia transversalis and fascia iliaca meet. Femoral canal contains some lymph vessels, a lymph node, and a small amount of areolar tissue. Femoral ring is an oval opening having a diameter about 1.25 centimeter and is bounded in front by inguinal ligament, behind by pectineal fascia covering the pectineus muscle, medially by lacunar ligament, an extension of inguinal ligament, and laterally by medial septum of the femoral canal. It is closed by condensed extraperitoneal fatty tissue which is named as septum femorale. This septum is pierced by numerous lymph vessels from deep inguinal lymph node to the external iliac lymph nodes and is covered by parietal peritoneum on the abdominal side, where it presents a slight depression which is named as femoral fossa. It is a point of weakness of the anterior abdominal wall where abdominal contents can protrude through this weakness, and this status is named as femoral hernia. Femoral hernia is bulging out of abdominal contents through femoral ring and femoral canal. It is more common in females because of wider pelvis, wider femoral canal, and small size of femoral vessels in females. It comprises a neck and a sac. The sac is covered over by peritoneum, that is parietal peritoneum, femoral septum, transversalis fascia, cribriform fascia, superficial fascia, and skin. It mostly contains greater omentum. It follows a course as it passes through femoral fossa and septum femorale. It passes downwards through the femoral canal, then it passes forward through the saphenous opening, and finally it ascends upward along with superficial epigastric and superficial circumflex iliac vessel, and the reduction is in the opposite direction. In strangulation or obstruction of the hernia, only option is to enlarge the femoral ring by cutting the lacunar ligament, that is the medial boundary of the ring. Normally, there is no danger. Occasionally, an ab- abnormal obturator artery may be lying along the medial boundary of the hernia, that is above the lacunar ligament. Normally, obturator artery is a branch of internal iliac. Occasionally, abnormal obturator artery replaces the pubic branch of the inferior epigastric artery, and usually it passes lateral to the femoral hernia, but occasionally it may pass medial to the medial to the femoral hernia lying above the lacunar ligament. In such cases, cutting the medial edge of the femoral ring, that is lacunar ligament, may we may cut this artery. If this happen, severe hemorrhage occurs. Now at the end, let us see differences between inguinal hernias and femoral hernia. Inguinal hernia is more in males, whereas femoral hernia is more seen in female. Inguinal hernia passes through inguinal canal and superficial inguinal ring, whereas femoral hernia passes through femoral ring and femoral canal. Neck of the inguinal hernia lies above and medial to the pubic tubercle, whereas neck of the femoral hernia lies below and lateral to the pubic tubercle. Inguinal hernia contents are mostly intestine, whereas contents of the femoral hernia are mostly greater omentum. Inguinal hernia is located above the inguinal ligament, whereas femoral hernia is located below the inguinal ligament. As regard the course, inguinal hernia passes forward, laterally, and backward, whereas the femoral hernia passes downward, forward, and upward. Hence, the direction of the reduction in case of inguinal hernia is upward, laterally, and backward pressure, whereas in case of femoral hernia reduction, pressure is applied downwards, backward, and in upward direction. Inguinal hernia is more than femoral hernia, whereas femoral hernia is least common. Inguinal hernia strangulation is less common, whereas femoral hernia strangulation is more common. Comments and suggestions will be welcomed. Thank you for listening and watching.